Resident Service Award program was called the Harlem Healthy Minds program. It is a mental health curriculum that I was able to create from scratch and provide to adolescents and teens in the Harlem area of New York City. My name is Ariel Petty. I'm a family physician and a recipient of the Family Medicine Cares Resident Service Award. The students who were able to participate in the Harlem Healthy Minds program through the Resident Service Award really appreciated having the time and the attention that goes into mental health education. When I was in medical school, I had the opportunity to do a service award program. There was a need for mental health education for adolescents, and I really wanted to bring that to my new city and residency in New York City. And so it was actually through the AAFP Foundation that I found the Resident Service Award, and I found a way to continue to engage students in mental health education. Through the Resident Service Award, I was able to provide this curriculum to students aged 13 to 18 in the Harlem area of New York City. So what we do is we provide weekly sessions on specific mental health topics, coping skills, and mindfulness and meditation, and just really having a better way to communicate when you need help. They were better able to advocate for their own mental health as a result of the program and the support from the Resident Service Award. The students felt like they really got to learn about things that they wouldn't have been able to otherwise. Really important mental health skills and tools that they just had not ever been taught before where they were. Now, as a practicing family physician, I am very intentional about being able to engage with my community and provide mental health care and education to my communities and patients. When we invest in the AAFP Foundation, we support everything that it means to be a family physician. Now more than ever, the humanitarian programs of the AAFP Foundation are needed. Our patients and our communities need us, and it is through programs like the Resident Service Award that we are able to be there for them and to show them that we will continue to be there for them.
My name is Shanine White. I went to medical school in Havana, Cuba at the Escuela Latinoamericana de Medicina. I decided to get involved with the Family Medicine Cares International program to continue my journey on community involvement and global service. I was very determined to be a bilingual doctor who spoke Spanish. That led me to going to school internationally, where I learned to speak Spanish fluently and then come back to complete my training in South Florida. Family Medicine Cares International is a portion of the broader aspect of the AAFP Foundation that focuses on global health. FMCI is not just a one-week service trip, it's actually a broader effort to continue workforce development and medical education. This work is really important because it puts family medicine at the forefront of global health, where it really belongs. We are human beings and we have necessities of life. We have social determinants of health, and so that doesn't go away in one day. We need to be a part of this every day, and that's what we're focusing on, sustainable outcomes. I think it's our job to challenge those borders that society has created. We have the opportunity to put health at the forefront, and if we answer and give solutions to health, then we have better communities overall. Family Medicine Cares International really has a key role to play in making this global impact a reality. I feel empowered. I'm a Jamaican American who's grown up in South Florida. I'm a woman in medicine, and just to be a part of a project like this, to focus on communities that are often overlooked. The AAFP Foundation is at the forefront of making this possible for so many people in the United States and across the world. When you're donating, when you're giving, you're funding not just a trip, you're actually funding and investing in primary care and family medicine for the world. And if we can really connect with one another, realize that we all are of the same organization, the same society, the same global experience, then it's simple. We can connect, we can make a difference, we can give of ourselves, our time, and we'll see the impact for years to come.
This clinic, the Guadalupe Clinic, sees a large portion of patients who don't otherwise qualify for insurance. They don't have Medicare, they don't have Medicaid, they could be immigrant patients. So really the working poor is who we serve. And if we didn't exist, I would say a large number of patients wouldn't otherwise be able to get care in our community. I am Cheryl Beard. I am a family physician and I volunteer at the Guadalupe Clinic here, and I've been a volunteer here for about 20 years. So the care that we give here at the Guadalupe Clinic is very broad. We have lots of family physician volunteers who volunteer their time to give primary care services to patients, but we also have a large number of specialists who come here and are willing to see patients who otherwise couldn't get care.
Guadalupe Clinic is very busy. Our day starts at 8:30 a.m. Our primary care providers are ready to go by then. We have an awesome team that starts taking patients around that time. In the morning shift, we see about, I would say, 25 to 30 patients per shift.
At the clinic, we take care of everyone. Anybody who walks through our door, including many walk-ins, we see the same day. Our patients mainly come from the Wichita area. However, our reach goes all the way to western Kansas, to Liberal, which is 4 hours away, all the way to Salina, southeast Kansas, and northern Oklahoma. So we take care of a lot of people in a large region.
Many times the patients otherwise wouldn't be able to qualify for care, and they get a full-fledged physician being able to see them and provide the care. They're extremely grateful for the services that are provided here.
We so much appreciate the Family Medicine Cares USA grant because we see so many patients that have absolutely nothing. They're working, just trying to take care of their families and put food on the table, and it's really important to them and to our mission.
The USA grant was a godsend to the clinic. It helped us in many areas. We received the grant for an EKG machine. It helped us tremendously with patients that are coming in with chest pains or heart concerns. It prevented some of the patients to go to the ER. The team love it. It was a big impact here at the clinic. But not only that, we also received a bladder scanner with the grant that we received.
I would really like to say thank you to the AAFP Foundation donors, because without their support, we wouldn't be able to provide the care that we provide.
To all the donors that give to the foundation, I just want to say a sincere thank you. It's really making a difference in our clinic and the patients' lives at Guadalupe Clinic in Wichita, Kansas. So thank you.